Okay, so now I'm going to be doing her cardiovascular exam, and I will first check her general appearance again. Her breathing effort's good. I will look at her positioning, make sure she's sitting right. We're on a couch, we're not at an exam table, so that's not as good. I would start with measuring her bilateral blood pressure. So I take her blood pressure here and her blood pressure here and make sure they were in the same vicinity. And then I'd be inspecting her face again, looking at color, seeing if there's any orbital edema around the edema around the eyes. And there isn't. Her expression is nice and relaxed. I'd be looking at her neck, inspecting the carotids, feeling for pulses. I would not be feeling for them at the same time, obviously. And then I would be taking a look here at, her substernal notch, which is here. Her clavicles are here, and her first rib is underneath the clavicles. Then I'd be palpating her second intercostal space, her aortic area across the sternum. The third one I would be looking at is Erb's point. The fourth would be the tricuspid, and the last would be the apical, which was over here. And when I feel for it, I want to make sure it's right under here, not way over, because that would be indicative of an enlarged heart. So Sarah, I'm going to have you lay down on your left side for this part of the exam. Hoping we can see what we need to see with this video. Try and bring it closer, trying to stay under 10 minutes. So I will be inspecting her carotid pulses here, seeing if I can see any pulsating. I'd be looking at her jugular vein to look for jugular venous distension. Again, I don't see that. She should be at a 35-degree angle. I would note that jugular JVD would be indicative of an overload. So then when I have her lay back on her back, I'd be looking to make sure that there was no lifting or heaving of her heart, and that if I palpate it, the same, I don't feel any lifting or heaving. I'm going to inspect her areas. Again, I'm going to listen, I'm going to feel for the aortic area across the sternum. I'd be looking at Erb's point, the tricuspid, and the apical area. So I would also palpate that with this part of my hand. I would be palpating to see if I could feel vibrations or murmurs, things like that. I don't feel any of that at all. I don't feel any of that. So I would be feeling off for that. I would be looking for vibrations with that palm of my hand. And then while she's laying there, I would listen again to her heart sounds, be listening for S1 and S2, lub and then dub. And I would be doing that in the atrial area, in the pulmonic, so the atrial area, the pulmonic area, the Erb's point, the tricuspid, and the apical. So I just noticed it's hard to see. So I'm going to have her sit up so I can show you that I know where the spots are.
Like all the way?
No, that's fine. Just so that I can show her here. So aortic, pulmonic, down by the aortic, pulmonic, Erb's. Down by the fourth intercostal is the tricuspid, and by the fifth intercostal over here is the apical mitral area. So after I had palpated all of those, I'd be listening for S1 and S2 heart sounds in all 5 areas. I'd be noting the rate, the rhythm, and the pitch. And I'm going to have you sit up because another way to assess for murmurs is put your feet down so you can see better. I would be listening again. I'd be listening to lean forward. I would listen with the small part here, the bell. I'd be listening here I'd be listening in all the spots again for murmurs. I'd be noticing that in the aortic and pulmonic area that S2 would be louder, that would be the dub. And when I got down to the mitral, when I got down to the tricuspid and mitral areas, the S1 would be louder, so the lub would be louder. So louder dub up here, ladder lub down here. So S2 is ladder here, S1 is ladder down there. And I'd use the bell of my stethoscope to listen for murmurs and S3 and S4 sounds. I also want to note that there are no S3 and S4 sounds on her. She's nice and very perfectly healthy. So I would have her lean forward and I would listen in the aortic area. Oops, not that far. I would listen in the aortic area. Sorry, I'm like all mixed up because I'm so nervous. But I'd be listening in the aortic area to listen, the aortic and the pulmonic areas to listen for the murmurs. And lastly, I'm going to be checking for her peripheral vascular. I would be looking at her skin integrity, color, hair distribution. That's all normal. She has no edema. Her skin bilaterally on her hands and on her feet, because I'll be checking for lower extremities as well, is normal. Nothing's cold. It's all good. I'll be checking her temporal pulses. I can feel that those are +2 and normal. I would be checking her carotid pulses. Those are normal. I'd be checking her brachial pulse here. I'd be feeling for that bilaterally. Those are both +2 and normal. Then I'd be checking for her radial pulse. I can feel that nice, +2. Ulnar pulse, perfect. And then I would be inspecting her lower extremities. You can't see them, kick up a leg. So normally I would not have my patient kick her leg up, but I just wanted to show you her femoral pulse is in her groin area. I'd be feeling that on both sides, looking for hopefully a +2. Under her knee, her popliteal pulse, I'd be feeling for that bilaterally, +2. Then I'd go for her posterior tibial pulse on the inside of her ankle, and then I'd be feeling for her dorsalis pedis. All of these +2, and I'd be looking for firmness, her skin turgor, her temperature, and all the pulses. And I'd be looking to feel that it was a regular rhythm, that it was nice and strong. I'd note whether it was bounding or weak or thready, and that's pretty much what I would do. Also, when I'm looking at the lower extremities on elder adults, I'm looking not only for edema, but I'm looking for discoloration, ecchymosis, bruising, scars, signs of peripheral vascular disease.